What we're going to be doing, we're going to go through the different topics that's going to help you to pass your written state exam. So if you look at 1, 2, 3, 4, and 5, the first thing that we see is understanding CNA written exam test strategy, right? The best nursing care, which is feeding, bathing, and vital signs. Number 3 says promotion of safety, which is falls, infection controlled, and emergencies, right? Then we have residents' rights and specialized care plan, confusion, chronic condition. And here it's saying on number 5 says the role of a CNE, which is rights communication and how to be professional. Let's look at the agenda. And the agenda that we have here today is why students fail. Why do you think you fail a written exam? Look at some of the things that can cause you to fail your exam. Reading too fast, not understanding the keywords, guessing without strategy, or choosing unsafe answers. And sometimes we are very, very anxious about something, anxiety. We're very anxious about something, so we cannot concentrate or we have that fear of testing. So, how do we correct that? Mastering CNA questions. All right, so let's look at it. Identifying the keywords. So, we're going to identify the keywords of a sentence that you are reading, test questions that you are doing. How do we identify the keywords? Focus on identifying important words, the questions to clarify what have been asked and guide your response. So for this, you're looking for the word that is actually going to tell you this is what the question is asking me to do. Recognize the problem. Determine the main issue presented in the question to understand the scenario. Because remember, a lot of these questions are scenario questions, and make sure they're accurate decision. Okay? Eliminate. Do you eliminate your answers, guys? Think about you reading a test questions. You must eliminate the ones that make no sense. Now you're left back with 2 questions that you're puzzling with. Go back to the keyword, ask yourself, what is the question asking me to do? And then guess what? Right there, that's the answer. Yes, you can do it. So eliminate is cross out the answers that could be unsafe or clearly incorrect to narrow down the choices. Select the safest response. Choose the answer that is both safe and kind to ensure the best outcome for the patient and their colleagues. Very good. Mastering CNA test questions. All right, so let's look at the key areas of a CNA exam. These are the areas that you guys are testing on. Basic nursing care, right? So let's look what basic nursing care is. Is assessed knowledge of direct patient's care, including hygiene, comfort, and daily living activities. Let's look at promotion of function and health, because remember, you're getting questions on these topics. Focus on supporting the patient independence and encouraging healthy lifestyle and activities. Promotion of safety. Test your knowledge, maintaining a safe environment, preventing injury and infection. So pretty much once you're answering the test questions, look for all the safety. If you see the spill on the floor, what would you do as a CNA? If you walk into the room, the patient is laying flat on the floor, with with breathing problems, what would you do? Questions like that. You're gonna look. Safety comes first. Specialized care covers care for residents with specific health changes, such as pain, confusion, chronic conditions, dementia, and other specialized needs. So, those are the things that we're looking at, which is going to help you with answering the different sections that you're going to be testing on. And remember, reading is very important. A lot of us do not read the entire questions before we answer them, right? Please read all the answers. Read the question, read all the answers. Eliminate the ones that make no sense, and then know you have to choose the keyword from the sentence and answer your questions. Remember, you have 2 minutes on each question. All right, understanding the test format. Let's look at multiple choice questions. A lot of people is afraid of multiple choice because they're so similar and they're very tricky. So, the exam features 60 multiple choice questions, each designed to eliminate your CNA knowledge and decision making. Time management, that's the thing. Time. You have 90 minutes to complete the test. So, managing your time efficiently is essential for success. Okay, so that means you cannot spend more than 2 minutes on one question. If you are staying too long on one question, please mark for review, continue to the next questions, and go back to that question. Do not waste your time on one question if you cannot get the answer. Okay? Choosing the safest answer. Read all options carefully and select the safest answer that's aligned with correct CNA procedures and practices. Okay? So let's continue. So, understanding the test formats. How are we doing so far? I know you guys can do it. Just listen to my instruction. Take time out to think about how you read, how you're going to answer these questions. Important words on the test. So let's look at some of these words that you might see on the state board. These are like keywords: first, best, safest, main goal, most important. You will see these words. Stop and think when you see these words. Okay? Basic nursing care. Helping resident every day. So these are basic nursing care. So see if these tips can help you to answer these questions. Let's think about it. Assisting daily activities. Nurses support residents in eating healthy meals, bathing them, dressing, or to maintain everyday comfort and cleanliness. Ensuring safety and mobility. Nurses help residents move safely, use the toilet, and prevent injuries, fostering independence and well being. Let's look at monitoring and comfort care. Nurses regularly check vital signs and report pain, ensuring residents and healthy comfort every day. Okay? Helping the resident every day. Let's look at this. That's a beautiful resident. We are giving comfort. Easy memory rules, which is the 3 C's. The 3 C's we're going to remember. Check resident cleanliness. Confirm if the resident is clean to maintain hygiene, prevent health issues. Cleanliness is vital for well-being. Ensuring resident comfort, of course, because remember, comfort care comes first. Look at the scenario question, guys. Look for comfort. Okay, this person have cancer and their end of life care, the only thing that you can give is comfort. Very good. Monitor if the resident feels comfort to support physical and emotional well-being. Comfort improves quality of life. Decide to call the nurse. When do you decide to call the nurse? When do we call the nurse? Access to calling a nurse necessary for additional help for medical attention. Timely to resident safety. So just pay attention to when we're going to be able to call the nurse. All right, so let's look at understanding vital signs. Hope you guys know your vital signs because that's a part of nursing care as well for the CNAs. Normal vital signs, healthy ranges include temperature near 98.6 Fahrenheit, pulse is 60 to 100, and respiration breathing is 12 to 20 breaths per minute. Warning sign. These are some of the warning signs of vital signs, guys. Let's look at that. Rapid breathing, chest pain, confusion, or severe pain should be reported. That's stat order. Immediately as they may see signals serious and health problem. So you should report those problems. Safe feeding basics. How do you feed a patient? Upright position for safety, of course. And remember, you will be getting feeding on your state of birth exam. So try to know these things as well. Always ensure the resident sits upright before feeding to reduce the choking risk and help swallowing. And we call that the Fowler position. Very good. Small, slow portion. Feed. A lot of students out there, whenever you're doing your state board, you're feeding your residents too fast and they will grade you down on that and fail you as well. So make sure feed small amount of food slowly, giving time to chew and to swallow safely with each bite. All right, so do not do it too fast. Always offer water first, then your bites after. If the residents cough during feeding, stop at once and carefully access before continuing. Never force feeding. Never force food. This increases aspiration and discomfort risk, right? Also prioritize generally and respect of feeding. So do not force feeding. Make sure the person swallow and the mouth is empty before you put more food in the resident's mouth. Very good. We're doing good so far. Toileting basin essentials. So let's look at resident safety. Assess resident carefully during toileting to prevent falls, accident, ensuring a secure environment. Hygiene practices. Always wear gloves to maintain hygiene and reduce the risk of infection for both resident and caregiver. Privacy and respect. Respect the resident's privacy at all times, fostering dignity throughout the toileting process. Monitoring and reporting. Watch the signs of blood, pain, or absence to urine and report promptly to the nursing staff for follow-up. So these are toileting basic essentials. Okay, doing so good. So far, so good. Promoting resident safety, guys. I'm going through all these tips. That's going to help you with the written part of the exam. I will be doing some test questions as well, but this is going to help you to answer your test questions with confidence. Promoting safety, resident safety. Preventing falls. How do you prevent falls? Lowering bells and lock the wheels of the bed and chairs. Reduce the risk of the resident falls and injuries. Eliminating slip hazard. Indicate clean up spills helps maintain safe environment, minimizing the chance to slip related accident. Accessible call light. Call light within reach to enable resident to request assistance promptly, enhancing overall safety and responsibilities. Proper footwear. Of course, we must have proper footwear. That can cause the hazard to fall as well. Resident wearing shoes with adequate grip helps prevent falls and contributes to safer living environment. Very good. Let's look at essential infection control. Let's look at that. Importance of hand washing. What is the importance of hand washing? It helps us to prevent germs and bacteria from entering the human body. Throughout hand washing, always after every patient, interactions as vital to prevent the spread of infection in the healthcare setting. Proper gown usage. Always wear gloves when handling bodily fluids and never reuse gloves between tasks or patient to maintain safety. So that is the proper glove usage. Separating clean and dirty items. Keep clean and dirty items clearly separated to reduce the cross contamination and keep the environment safe for everyone. Remember, guys, gloves, we only use gloves one time. When you must stay. Okay. Supervise confused or dizzy patient. You must stay with this patient to make sure this patient is okay. Residents who are confused or dizzy required consent supervision to prevent accident and to ensure their safety. Respond to medical emergencies indicate presence is critical for residents who cannot breathe, bleeding, or falling to the provide prompt help. Let's look at ensure emotional reassurance. Constant supervision offers emotion reassurance to residents who feel scared, helping them feel safe and supported. Very good. Spotting specialized care issues. So let's look at that. Recognizing physical and emotion changes. Monitor for pain, confusion, behavioral changes, weakness, breathing difficulties, swelling or less of appetite in the resident. Let's look at importance to prompt reporting. Immediately reporting an unusual sign ensure the resident receive appropriate care and help prevent complication. Maintaining safety, guys. Careful observation and communication contribute to a safe and supportive environment for all the residents. So let's look. Your job is you see it, you report it, and keep safe. Okay? Effective communication in dementia. And I hope you guys remember what is dementia. So, communicating with a person that has dementia, calm and gentle approach. And remember, guys, you have 7 questions that is going to be asking you questions about dementia. Okay? To know about Alzheimer's and dementia, you have 7 questions on the written state exam for the CNAs. Always remain calm and speak softly when interacting with someone with dementia, fostering reasoning and environment. Avoid escalating distress. Never yell, argue, or grab, as such action can increase confusion and depress for those with dementia, building trust and safety. So you have to build your trust and safety with the Alzheimer's patient or dementia patient. Be compassionate, and respectful communication helps to maintain the trust and ensure a safer, more comfortable environment. Okay, so let's go the role of the CNE. What is the role of the CNE? So you have residence right, communication, privacy, professional behavior, reporting, and recording. Let's look at understanding the residents' rights. Guys, you must know what are the Bill of Rights or the residents' right. Right to make their choices. All residents have the right to make choices. So if you have some test questions, right, and they refuse certain things, they have the right to make those choices. Resident can say yes or no to decision impacting their lives, fostering personal autonomy and dignity, privacy, belonging, protection. Residents' privacy and personal items must always be safeguarded and maintain trust and comfort. Safe and respectful care. Residents deserve safe, respectfully care and freedom from any form of abuse or neglect. And a lot of our patients out there are getting neglect. But as a CNA, guys, you should know the signs of the patient getting abused. Let's look at reporting abuse and neglect. Recognizing the signs of abuse. How do we recognize the sign of abuse when our patient is getting abused? Abuse can include physical harm, yelling, rough care, neglect, or financial exploitation. Look for unusual changes or injuries. Share responsibility. Everyone has the role in protecting vulnerable individuals. Reporting concerns help maintain safety and dignity for all residents. Trust and take action. Always trust your instinct. If someone feels wrong, report it immediately and ensure the resident's safety. Okay? Mini practice tests. Essential test day tips. Okay, so let's look at tips to pass the exam. Read carefully. Read questions slowly to fully understand and answer accurately, avoiding careless mistakes and misinterpretation. So read your questions very carefully before you choose your answer. Use magic 4 steps. Apply the magic 4 steps to trickle each test question in this systemic or any organized manner. Trust your instincts. Change your answers only if you recognize it's misreading. Otherwise, trust your initial instinct during the test. Guys, you have to look at these tips, and that's how you're going to pass this written CNA exam. Take deep breaths. Stay calm and confident. Take deep breaths to maintain calm and focus, reminding yourself that you are prepared and ready to succeed. Okay, so look back over the tips on the slides for you to help you pass your state board. And final of all of this, empowering final confidence. Read the test question, choose your answers. Do not use any other material but your brain to do these test questions. Overcoming past setbacks. Previous challenges were due to missing resources, not lack of potential understanding. This help you move forward with confidentiality. Equipped for success. With the right tools, resources, your right reading, choices for success may improved greatly. All right, trust your preparation. Trust yourself. Believe in your preparation and abilities. You are now fully ready to succeed and achieve your goal. Please, that's the end of this. But please, guys, go over the tips that I went over. Read and read everything to the end before you choose your answer. Eliminate the questions. Read through the slides. Follow my instructions, and I will be putting out test questions. So you're going to use these guidelines to do your state exam.